Hey everyone, my name is Johnny,
Hi, I'm Nate.
I'm
I'm
Akshita.
Susie.
and we're part of Courage, a youth health coalition that plays an active leadership role in addressing teen drug and alcohol use across Contra Costa County. Particularly, we are part of Avengers Assemb Pill, the subgroup which is focused on prescription drugs.
Great job. Hi, I'm Jamie Rich. I work for the Center for Human Development, and I'm an adult ally to Courage and particularly to Avengers Assemb Pill. And we are very happy to have April Rivero with us. We are going to go through a set of interview questions to learn more about prescription drugs in the world, and April is very qualified to talk to us. She is the president of her own nonprofit called the National Coalition Against Prescription Drug Abuse. And she's also chair of the Contra Costa County Meds Coalition, which stands for Medicine, Education, Disposal, Safety. And I'm going to leave it at that and let her tell you a little bit more about what it is she does.
Okay, so as you mentioned, Jamie, I founded and actually lead and have since 2010 the National Coalition Against Prescription Drug Abuse. And we actually celebrated just yesterday on June 2nd our 10-year anniversary of having become a formal nonprofit organization. So since the beginning of our organization, the primary focus has really been to educate community members, and that means youth as well as adults of all ages, about prescription drug dangers and how we can all keep ourselves safe from the downstream impacts that could include overdose deaths, overdose and surviving them but having some issues after or not, and then of course also substance use disorder that's associated with the medications that we're out there speaking about. So the medications would typically be in the categories of sedatives, stimulants, and painkillers that we're most concerned about. There are all sorts of other medications, but those are the ones that you can really get into trouble with. And then in 2012, I branched off to make sure that we were able to really gain the support of our Contra Costa County Public Health Department and others within Contra Costa County itself to have a high focus on that, all the communities in our county. And that's when we established the Contra Costa County Meds Coalition. And so since 2012, I have led that as well. And it's the same thing. We're focused on primarily education, but we also do what we can, and that's true of NCA PDA also, in the areas of policy change at the state, and in the case of NCA PDA at the federal level, and then also any legislative advocacy that we think will help, either set new laws in place that will help the cause, or otherwise sometimes we actually fight legislation that we don't think is going to be helpful. So it's all of that.
To start off our questions, we would like to know how it is different for your work being stuck at home due to COVID.
Well, I do have a home office because we're a nonprofit and we don't have deep pockets. We do everything we can to save our organization money. So I would say, first of all, we all are volunteers. I don't have a salary to manage the work that I do, nor does anybody else that's affiliated with us. And what I've found is, yeah, I'm still working from home, but before I was out, it felt like all the time going to meetings, physically getting in my car. I live in San Ramon, and so there aren't meetings in San Ramon typically. I'm, traveling, the closest place was Danville, but typically into Martinez or East County, maybe West County. So the big difference is I'm doing all my work here from my home office. So my surroundings are the same, but I'm not having to go to meetings, and I'm finding that I'm more productive because of it, truthfully, because I'm still doing meetings. It's just they're here. They're physically here. I don't have to do the travel. So I think I'm going to continue, in fact, as much of that as I can.
I have another question.
Okay.
What are some recent developments that you could tell us about in the opioid crisis? Like what's been going on recently?
Well, most recently, and some of this is anecdotal, because it tends to take a while before we get actual formalized data, that we can count on. But, you know, I'm constantly getting messaging, whether it's text messages pointing me to particular articles. I have Google alerts set up. Bottom line is the information I'm getting is that there's a high level of concern about opioid use disorder progressing with some people that were maybe in the early stages of their recovery, but the support that they had available to them before has really become kind of minimized. So where they might go to a Narcotics Anonymous meeting, you know, maybe in some cases every single day so they could connect with others in recovery and get that level of support, those meetings aren't happening now unless they're virtual. Now, I do understand that many of them have turned virtual, so that's a help. But, you know, in the end, especially for somebody that's struggling, you know, those really personal connections make a huge difference. And so not being able to physically meet up with people, maybe their sponsor or others that are struggling and, you know, they're all working together towards sobriety, that's kind of an issue. And then the additional thing is like the methadone clinics, you know, some people to sustain their sobriety, they will need to go to a methadone clinic every single day to get a dose of methadone. So there have had to been some changes in how medication-assisted treatment, MAT specifically, is made available to those in recovery. The other thing that I'm hearing, this is disturbing, would be that mental health issues are increasing because there's so much stress and, you know, people are stuck at home and not able to get out and socialize like they usually were. And so with all the anxiety, the concern is mental health issues like anxiety, depression are increasing. Often people will move towards substances of whatever sort. It could be alcohol. It could also be, of course, prescription drugs to try to handle those feelings that they're having that they're struggling to cope with. So I would say those are the main things that I'm at least hearing about. And some people are actually sharing specific stories with me about. So real concerns. And of course, what does that mean for groups like ours, yours and our organizations? You know, in terms of prevention work, does that mean we're going to have more to do, you know, this next few months? I think maybe so. It's going to be that much more important for it to get, you know, to get our messaging out there. So I'm just really happy that you're doing this session today, and all the work that you do is really very valuable and will continue to be.
Yeah, so you kind of already answered my question, but I was just wondering like how COVID-19 and quarantine was affecting them. So you would say it's all been like pretty negative?
You know, I don't know that it's all negative because, you know, you can't always physically get in a car and go someplace anyway for whatever reasons. So the positive would be that people are being more creative now to find other ways to connect that they wouldn't have before. So nothing really is as good in my mind as, you know, personal connection, physical connection, but, you know, some of these other methods can work better for those who maybe are homebound. They can't get out. The fact that everybody's kind of recognizing, in my world at least, that mental health issues are something that we really need to tend to, maybe more now than, you know, maybe people are paying more attention to them now. I think it's a positive. You know, maybe we're all kind of looking at our family members and there's a higher level of alert, and that means that we can help them get treatment or support. The other thing is now, another thing that I'm really hearing strongly is that the virtual way of treating people. So, you know, having the opportunity to have a doctor's visit via, you know, a video session like we're doing here is really helpful too. So it can be really protective. It also is much more convenient, and I think we're going to see much more of that. So telehealth is a big deal, and it's growing, and it's going to become a big deal. A bigger deal, I think, especially for those rural areas where people just don't have access to treatment that much. You know, even when things are kind of normal, they struggle to find treatment at times. So this is opening up new opportunities.
With everyone at home and the increase in like mental health issues, do you have any like coping skills that you can recommend instead of misusing like prescription drugs?
Yeah, I do. I love that question because part of our presentations includes towards the end of here's all the bad things that can happen. from prescription drug misuse or abuse, we talk about alternative treatment solutions. And so both for physical issues, like, I really highly encourage people to avoid, painkillers, prescribed painkillers if at all possible. There are some great over-the-counter solutions like Advil, Tylenol, you guys have all heard about. In terms of mental health, though, I think that great coping skills include meditation, yoga. Everybody can do these things at home. There are great online programs now where you can go on board on a video session, or otherwise, maybe you already have been to yoga classes and you know what poses to do and the breathing techniques. There are things like that that can be done, and there are a lot of growing tools. Once again, people are recognizing the need for this. So Calm is one of those that I haven't checked out yet, but I've been hearing a lot about, that provide a lot of opportunity to connect with others and practice some of these skills. So, yeah.
Okay, coming on to our last question, what can young people do, such as Courage, to spread the word and take action for prevention?
Oh gosh, speaking out, just sharing messages like this. I encourage you to find other people to interview, in fact, maybe people with lived experience. My personal lived experience, all of the work that I'm doing is a direct result of me having lost my 21-year-old son. I know that you guys have heard my story before, but there are so many people out there that have lived experiences too. So try to find them. If you need help, I can help put you in touch with them. But, most of all, it's raising our voices, not being afraid to speak out. If you know people that have a problem or you're suspecting based on what you've learned might be getting into trouble or maybe already are in trouble, take action. Just don't ignore it. Call them out, ask questions, see what you can do to help. Your voices are the most powerful thing that you have. And you've always done a good job. I love Courage and the work you do. And Jamie's leadership has made a huge difference there too. But every one of you individually, even without being part of this group, as you move forward in your lives, can make a difference. Just speak out. Learn as much as you can, share that information, and make sure that we do everything we can to break down that stigma that's out there that keep others from speaking out.
Well, thank you. Do you have any last comments or things you'd like to share?
Thank you so much for doing the work you do. I love your your coalition and all the things that you've done over the years, and many of you have been there more than 1 year, I know. Additionally, just know that as you move into your adult years, wherever you are now, I can say there are coalitions out there that are doing this kind of work. See what you can do to join up and support them. So as you move out of Courage, find other opportunities in your community to help. We need as many volunteers as we can. And you guys are powerful. Your voices are powerful, and you can do a good job at that. I'll welcome you.
Great.
Right. Thank
Thank
you.
you, April.
You're welcome.
Thank you.